welcome to the Preemie Chats. Preemie Chats is our weekly educational session for healthcare professionals and parents to talk about what matters to you, to explore new ideas, and to learn together. I'm Fabiana Bacchini. I am a Preemie parent and Executive Director of the Canadian Premature Babies Foundation, as known as CPBF, and I'm happy to be your host today. CPBF is a parent-led charitable organization that helps families in and after the NICU stay through education, support, and advocacy. If you have a heart for preemies, whether you're a family or a healthcare professional, please check our website at canadianpreemies.org. There you'll find resources, the latest projects, and most importantly, a community of people who wants to see our little babies thrive. And if you're watching this session live today, bring your voice to the table. Leave comments and questions in the chat, and we'll try to address them during our program. It is through rich conversations like this that we can advance practice and learn together. So please participate and let us know where you're watching from. And it is still November, and we remain dedicated to raising awareness about preterm birth and its long-term impact on families and the babies. This year, our global call to action focuses on access to quality care everywhere. We recognize the significant disparities in care worldwide and even here in Canada, especially with our remote and rural communities. And in honor of our diverse families across Canada, the Canadian Premature Babies Foundation has partnered with Our Kids Health to launch the Preemie Hub. I'm thrilled to introduce those two incredible individuals who made this initiative possible. Dr. Ripudaman Minhas, the visionary behind the Our Kids Health Project, and Dr. Iryna Dvoretska. They will introduce the Our Kids Health Project and the Preemie Hub, these two initiatives designed to support families and healthcare providers in caring for premature babies. Our Kids Health serves 10 culturally and linguistically diverse communities, providing tailored parenting resources and virtual support networks that reduce parenting stress and boost competence. The Preemie Hub addresses the unique challenge of raising premature infants, offering comprehensive, culturally sensitive resources in multiple languages. From understanding medical conditions to celebrating developmental milestones, the Preemie Hub provides a trusted, inclusive space for parents to access vital information, supporting families from all backgrounds in raising their preemies with confidence. And I have here the honor to introduce you to Dr. Minhas, who is a developmental pediatrician at the Women's and Children's Health Program, research leader at the Department of Pediatrics at St. Michael's Hospital and Unity Health Toronto, and Dr. Iryna Dvoretska, who is the research and community coordinator for Our Kids Health at St. Michael's Hospital, where she supports the Ukrainian community through tailored health education and outreach. With a background in pediatric medicine and specialized training in clinical research, she's dedicated to translating complex health information into accessible resources for families. Her work focuses on advancing health equity and fostering community engagement, creating impactful, culturally relevant programs that bridge healthcare and community support. And I couldn't be more honored to have the two of you joining us live on this very special month and to really introduce this project that we've been working together for almost a year now. So thank you for being here.
Thank you so much for having us, Fabiana. We're so excited to have this time to be able to share all of the work that we've been working on together with the Canadian Premature Babies Foundation and sharing with the folks that are watching what it's going to look like. So we can dive straight into maybe some slides that we had prepared to give you a little bit of background for folks that are watching about what the Preemie Hub is going to look like and what that means. It's a funny sort of term. So we're going to talk a little bit about that and our team's story with this group that we call the Our Kids Health Network. We're going to talk a little bit about how our vision really is empowering families with accessible evidence-based health resources to make the right decisions for their families, for your families. So I'll dive straight into some of these slides and we'll get going. So over the next half hour or so, we're going to go through some background on how child health information has historically been shared. We're really going to remind you that it has been inequitable. And when we think about the diversity of Canadian families, thinking about how can we do better, we're going to remind ourselves that diverse cultural linguistic communities have their own unique strengths and knowledge and values and perspectives and health information priorities. And also that if we want to think about supporting health behaviors and healthy and nurturing parenting behaviors, which are health behaviors, it's going to require us to think about how we can be creative and innovative in how we share information with families who need it most. Over to you, Iryna, if you want to talk a little bit about your background.
Sure, thank you, Ripo. My name is Iryna Dvoretska. I'm a community and research coordinator at St. Michael's Hospital for Our Kids' Health. And I'm supporting the Ukrainian community through health education and outreach, and with some background in pediatric medicine and my training in clinical research. I'm dedicated to translated complex health information into more accessible resources for families.
And a little bit about me. So again, my name is Ripudaman Minhas. My pronouns are he and him. I'm a developmental pediatrician in terms of my clinical background, and I work at St. Michael's Hospital site of Unity Health Toronto. I'm a dad. I'm really passionate about children's health, and particularly about trying to improve on historical inequities so that we can support families in really doing what they think is best for their children, for their youth. And we know that when we give families the information that they're looking for, that they feel more confident with their parenting and being able to make decisions for long-term outcomes for their kids. So that's a little bit about me. So, when we created the Our Kids Health Network, there were a few things that were lining up really, as I think of it, almost like a constellation of factors. And particularly, we were seeing more and more of this during the height of COVID in recent years. And so when we created the Our Kids Health Network, we were realizing more and more, we were hearing about this in the news, that there were important differences in how different communities participated in the healthcare system, both in how they accessed care, and we were hearing a lot about that in terms of vaccine uptake and whatnot, but also in terms of how they access information that helps them figure out what kind of care to access and when and who to go to, and how to manage things at home sometimes as well. We also know that online health misinformation and disinformation is rampant, can be lethal. It lives in every language and every platform, but evidence-based information is not as accessible for families. And here are some examples of things that we've seen online or that some of our community members have shared with us. Also, when we think about the diversity of experiences of Canadian families, we know that many BIPOC communities, so Black, Indigenous, and person of color communities, have a well-founded mistrust of institutions such as healthcare, which often is founded in ancestral or multi-general histories that are painful, including experiences of colonization, exploitation, enslavement, medical experimentation like we're seeing in this picture here, and ongoing marginalization in the healthcare system that we're all working to try to do better with. We also know that when we're thinking about health resources that do exist online, a lot of the vetted or mainstream resources that we think about tend to think of health and parenting and some of the decisions that families make in a way that is rooted in some of those colonial roots. So they tend to be Eurocentric in nature. Most resources are in English or maybe auto-translated. If they're available in other languages, we're hearing a lot from families that actually they still require a high level of literacy to be able to read some of that in-depth information. And so we really thought about what we could do. We also saw at this time, people are spending a lot of time on social media, and we're seeing more and more that families are looking for information online. And some of the data shows us that, adults in 2022 spent an average of 2.5 hours a day on social media. This is a global number. And that 2/3 of caregivers were looking for parenting information online around how to care for their child, not just in terms of their behavioral health, but also physical and mental health as well. That only about half found information that was helpful, and the majority of them didn't know how to review the accuracy of what they were finding online. So again, going back to that impact of mis and disinformation. We talk a lot about health equity in today's healthcare space, And there is actually a term called digital health equity too. And we think more about digital health and the time that we're spending online, the interactions we're having with providers online as well. But digital health equity, and there's a WHO statement on this, which talks about trying to make sure that all families have access to some of the nuts and bolts of digital health resources, which includes high-speed internet and devices. But in addition to that, also what they're actually accessing online, making sure that the information that they're able to access is relevant, it's reliable, and credible. And so when we think about some of that and think about, the knowledge that does exist, the information that does exist online, I sometimes it's helpful to think about again, where does that knowledge come from? Who created that knowledge, that information, and who thought, what should be created, what should be put on some of these websites, what should be shared with families, what shouldn't, how do we guide some of that information? And when we think historically, it's come from people in positions of power. So whether it was healthcare providers, hospitals, academic institutions, governmental bodies. And so some of you may have seen a slide such as this. It's often called a power flower, which thinks about health equity and inequity across multiple axes of identity. So around the outside of the flower there, you're seeing different petals, which can represent different parts of how the world views us or how we view ourselves. And the closer you are to the center is more historically, where power and position and privilege has lived. And with that, also the power to create information and perpetuate certain ways of thinking and parenting. And then that leaves people who are further to the margins of that flower in situations where they're not being seen, where their priorities are not being met. And so why does all of this matter? So I've described a couple of different concepts there, right? And so in bringing this together, we understand that there's so much that impacts us as we think about the decisions we make for our families. So as parents, and certainly from the healthcare provider's standpoint as well. And we know that the decisions that parents make and the behaviors that parents have are directly related to the health outcomes of their children and of their youth long term as well. And so it's really important to think about, how can we give families, all families, the access to credible, evidence-based, cutting edge, and the latest in terms of science and medical recommendations, where they're often being left behind. And so I'll pause there for just a moment as I take a sip of my tea. I've got a bit of a sore throat. I'm going to ask for folks that are watching online, if you could share in the comments, when you are looking online for health information, where do you look? Is it Google? Are there other places that you tend to look? And likewise, are there specific websites or platforms that you find helpful? Or if you're recommending things to other families within your networks or communities, what are the sorts of places that you look? I'll pause for a second. I'll welcome you to type into the chat. So when you're looking online, where do you look? I know within my clinical practice, I'm hearing a lot from families that people tend to go to Dr. Google. I think a few years ago, it used to be a lot of Wikipedia. And there are different parenting, I think, Facebook groups as well, online communities. And so lots of folks look, I think, in different places. I hear from a lot of families around resources being shared between parents in digital spaces, like in those Facebook groups and chats and whatnot as well. We have someone here sharing that they will look at or share the Mayo Clinic or WebMD, Mount Sinai, so some sounding like credible sources there. So I'll ask you to think a little bit about that in terms of, what's your go-to when you have a health question around a child's health. And really, when we're thinking about this, it's important to remember that information is such a key factor around and really a determinant of health, because the information, again, that families have helps guide, the outcome in terms of the health of the health in different dimensions, again, physical, developmental, and mental. So some of this kind of, again, taking back in terms of big step, taking a step back in terms of big concepts, Part of what we're really thinking about here is media literacy or health literacy. I used a couple of terms there earlier. So misinformation versus disinformation sometimes gets to be a bit of a confusing difference. So misinformation usually refers to false information that one's accessing that's not necessarily intended to cause harm, but is not true. It is not based in fact. On the other end, then we've got disinformation, which is false information that was actually intended to manipulate the person that's taking in that information or to cause damage or harm. And then also there's this idea of an infodemic, which I think is where we often find ourselves, where you've just got too much information coming at you, some of which could be false or misleading. It could be mis or disinformation. And particularly in online spaces, this can cause confusion. It can cause risk-taking behaviors. It can undermine also the trust that folks have in otherwise credible organizations and means of being able to take in information as well. And part of that, again, misinformation, I think historically, or particularly during the pandemic, we were seeing was being framed as a personal weakness. And really, I think we need to take a step away from that and realize that it's not people who are particularly, looking for harmful information, but really there's a system around them that has led to them being more vulnerable or susceptible to the impacts of mis and disinformation. And there's a lot to unpack there. And really, again, thinking about it's not people who fail when we're thinking about, their behaviors, but really systems. And that's part of where we come at, I think, from our kids' health standpoint around thinking about how can we improve some of those systems to equip families with information that can help them in their journeys. And from a practitioner standpoint, and this may resonate with some of the practitioners that are in the room right now virtually, where media literacy is so important because we've seen that with more and more access to media and social media, particularly online, that our relationship with our patients and clients has changed. On one hand, it's fantastic when a family comes in to see me where they have looked up online and they are invested in trying to figure out and be involved in the care of and decision-making of their child. At the same time, it's tricky because it's hard for them to figure out, what are credible sources. And our relationship has changed where previously patients would come into encounters and say, here are some of the symptoms of what I'm seeing with my child. What do you think it could be? Whereas now it is changed more into, I've Googled these symptoms. This is what I think it is. Do you agree? And that relationship change is important for us to think about because as parents and families are coming into clinical visits and appointments, there's already a preconceived sort of narrative and ideas there. And clinicians are now more fact checkers often in terms of these relationships. And so it's really important, again, to think about before those preconceived sort of notions start to be formed. What is that? They call it a media diet, actually. So what is it that they're consuming in terms of different forms of media and social media? And we also know that there is a disproportionate toll of mis and disinformation. And as I was saying earlier, we know that most of the evidence-based or credible information that does exist online is created for families who will take it in a Eurocentric way. It tends to be more in English, and even the visual representation on screen often. Families from diverse backgrounds, cultural linguistically, don't see themselves reflected in and seen in those spaces, and they feel othered. And because of that, we know that there is a high risk, as I was saying, of vulnerability to misinformation and also being mistrustful or being vulnerable to conspiracy theories and other ways of thinking in a system that they're participating in where they don't feel that they belong. And that's why we created Our Kids Health. And so the Our Kids Health Network really, and we'll get into the nitty-gritty of that a little bit more, was really to think about how could we create evidence-based content for families that were culturally and linguistically diverse. How could we think about the importance of representation and inclusivity? How could we really embrace the power of families and communities and take that a shift away from being a historically practitioner-specific and centered sort of approach to really what are the priorities and values of communities and families themselves, and sharing information that matters to them, and really supporting them in making informed decisions that are right for them. And with that, I think we've got a short video that will summarize a little bit of this. So we'll share a little bit of background of our team and what the project's looking like so far.
How do I talk to my teen about her anxiety? Can I trust vaccines? How much should my baby be eating? How do I talk to my child about distressing events? Parents and caregivers have infinite questions as they raise their children, and most families are searching online for information to help them answer these questions. However, reliable, relevant health information online and on social media can be very hard to find, hard to understand, and can be false and even harmful. This can leave families feeling unsure and in danger. With all that in mind, Dr. Ripudaman Minhas, a developmental pediatrician at St. Michael's Hospital, began to make evidence-based bilingual digital content for the Punjabi community during the pandemic. And from there, the spark for Our Kids Health Network was lit.
As a Punjabi Canadian myself, growing up, I never really saw my family's health priorities reflected in the content that was available or even in how healthcare providers were sharing content with my parents as they were making decisions for our family. They were always having to think about, how does this apply to our cultural context?
In only 2 years, that one channel turned into 10 evidence-based cultural linguistic health promotion platforms on social media. Filipino Kids Health, Tamil Kids Health, Hispanic Kids Health, Black Kids Health, Ukrainian Kids Health, Inuit Kids Health, Arabic Kids Health, Mandarin Kids Health, and Cantonese Kids Health, together making the Our Kids Health Network.
In a world where information can save lives, most existing health information online is in English, requires a high level of literacy, and tends to be Eurocentric in nature. This struggle is even greater for families who are Black, Indigenous, or people of color, and often come with painful histories of colonization, enslavement, genocide, medical experimentation, and marginalization in different ways. So the Our Kids Health Network is a health promotion program online that uses social media to bring reliable, relatable, evidence-based health information to families across a range of different cultural linguistic groups.
At Our Kids Health, our team works hard to ensure that each piece of information is peer-reviewed, adapted, and made accessible through easy-to-read infographics and digestible reels, all while ensuring accessibility and accurate representation in all of our content. So how do we achieve all of this? 1. Research coordinators. Through the tireless work of our team of research coordinators, who not only represent the cultural linguistic community of their platforms they manage, they also use their social media knowledge and training in evidence-based research to ensure the high quality of content and efficacy of the research we do.
Every time I meet a provider that's from the Hispanic Latino community, they're like, oh my God, this is so needed. I wish we had this when I was younger. Lots of enthusiasm from people who want to be part of this.
If we're giving a live talking to parents and caregivers in the Caribbean about how to introduce solid foods, Caribbean solid foods to their babies, having parents from the Caribbean being at that live asking questions about the kinds of spices that they use, what's appropriate, has been very surprising. Surprising because it teaches me that the community wants this information.
2. Our healthcare providers. Each of our platforms feature healthcare practitioners who identify with the cultural linguistic communities our channels serve. This ensures that our providers not only give expert healthcare advice, but can also address the culturally specific needs of their respective communities.
In our community, still a lot of mental health stigma. In this channel, we're able to provide the reliable knowledge about what is ADHD, the symptom looks like. If your child is struggling with stress and how it looks like.
When I was considering my career in family medicine, I didn't know any Black doctors. I didn't really have that role model that was definitely someone I could go to and emulate when I was trying to develop my career. So I'm very, very mindful of trying to do that with, my patients, with kids I meet. Oftentimes when I'm running into a child of color, I'm like, what do you want to do when you grow up? Have you thought about this? Have you thought about that? Let them know that there's no limitations and that they can really do whatever they want. Is there an apple in there?
Nope.
Some eggs?
No.
Oh, I gotta go back to med school.
3. Our online community. The Our Kids Health Network has made notable achievements, including a collective following of over 500,000 followers, over 40 million views across all platforms, and a new member joining one of our digital channels every 24 seconds. Our Kids' Health has proven to be a vital resource for people across high-priority communities.
Having a platform.
Maybe I'll pause there and we can get back to our slides, but we find that sometimes the video is just a helpful way to tell the story, and we all love seeing those adorable little kiddos as well. So that's a little bit of background around what it's looking like. I'll say, I'm going to hand over to Iryna in a moment, but those numbers are a little bit dated. As you know, social media changes really quickly. So we're at about double that. We're coming up to close to 1 million people who are followers of our channels right now, and about 90 million views of our content last year. So super excited now to talk a little bit about the project so far and sharing a little bit about what that's going to look like for Preemie content. Iryna, over to you.
Thank you. Can you press next slide, please? Thank you. Yes, I'm excited to introduce the Preemie Hub, a dedicated platform that's designed to support parents navigating the challenge of premature birth. It offers culturally sensitive resources, including medical information, developmental milestones, and caregiving tips in multiple languages. Our goal is to ensure that all families have access to inclusive, tailored assistance during this critical time. The main challenges faced by caregivers of premature babies. These including the stress of medical complexity and uncertainty, navigating healthcare systems and feeling isolated due to limited support, emotional strain, reduced bonding time, and adjusting parenting expectations further add to their burden. Our Kids' Health addresses these challenges by providing accessible resources, fostering connections, and empowering families through initiatives like Preemie Hub. So what our team does. At Our Kids' Health, transparency is key to maintaining the trust and quality and accuracy of our content. Each video and infographic undergoes a rigorous multi-step process for all 10 of our channels, including community engagement, expert reviews, cultural adaptations, and creative production. This ensures that every resource we share is impactful, inclusive, and meets the diverse needs of our audiences. Here are our community voices. We listen to questions and concerns that matter most of families of premature babies, and we shape our resources to address their needs. The topics that we will have include those on screen. The Preemie Hub will feature a range of topics, and they will be tailored to support families of premature babies shared across all our channels. These include practical guidance, such as navigating NICU, promoting family bonding, preparing for the transition to home, alongside with expert insights on breastfeeding, language development, and self-advocacy. We will also provide critical information on RSV vaccinations and about NICU care team. And also, we will also illustrate advice from experienced parents. So here's our team, and our team of community coordinators plays a vital role in connecting with families, ensuring that their voices are heard, and providing ongoing support throughout their journey. We serve as a bridge between Our Kids' Health and communities we serve. We facilitate engagement, gather feedback, and ensure that our content remains relevant and impactful. With deep understanding of unique needs of each community, we help tailor our resources to ensure that we are delivering the right support and at the right time. Here's our providers. Currently, we have over 70 providers already, and this slide just highlights the dedicated team of providers who play a crucial role in supporting families throughout their journey. And our network includes pediatricians, neonatologists, nurses, lactation consultants, and social workers, all working together to ensure the best possible care for both baby and family. By collaborating closely with Our Kids' Health, these experts contribute to the creation of accurate, reliable content that empowers parents and caregivers with knowledge and support they need. Here is a sample of engaging and informative content families can expect from Preemie Hub. Each piece is carefully designed to provide practical advice, emotional support, and expert knowledge tailored to the unique needs of caregivers and their premature babies. From videos to infographics, our content is culturally adapted, accessible, and created with input from healthcare professionals. We are proud to collaborate with a range of esteemed partners who help us to enhance the quality of our work and expand its reach. Our partnership includes global and national leaders in child health, such as the World Health Organization, Canadian Pediatric Society, Science Up First, and many, many others. These partnerships enable us to provide evidence-based information, support, and resources to families, ensure that every piece of content we share is grounded in latest research and expert knowledge. So stay tuned for Preemie Hub, follow hashtag OKH Preemie Hub, and yeah, find out more about Preemie content.
And I think we should be, the launch of the initial content is going to be happening in the next couple of days on our different channels. So we invite you to follow along, and we'll share in the chat as well some of the links for our channels there. So we invite you, if you're interested in partnering, if you're a healthcare provider or an agency, or if you're interested in learning more about the project or in helping to amplify it, please feel free to reach out. My email address is there, and also at the bottom of your screen, you're probably seeing our current website as well. And really our vision is to make a one-stop shop on our website where we'll have the Preemie Hub. So it'll be a one-page full of links with infographics and videos for families from these different communities, with practitioners who are from those communities helping to create that content. So we're excited to be able to launch that and again respond to what Preemie families would think is helpful. And with that, we'll pause. That's it in terms of the slides that we had wanted to share. And we'd love to hear if you have questions and chat a little bit more. Oh, I think you're on mute.
Of course, after 4 years, I still do that. But thank you so much for this wonderful presentation. It is always learn something new every time you present this content, and how you came up with this idea for Our Kids' Health is really amazing to see, and such an important work. I think not only for us in Canada, where we have a very diverse community, but more and more I work with different countries where they also have a very diverse communities. I see that more it's important across the world to have this kind of medical information available for families. You launched this during COVID to answer probably questions back then, and then you expand into this massive network now. Have you seen from the communities, like the feedback from the communities themselves on how important it is to have these materials for them? Because as you mentioned, like most of the information comes from top down, not from community to community. So what is the impact? So we see the numbers, but what is the impact the community gave to you in terms of stories and how they feel? They feel seen, they feel supported. I just want to hear some of your stories from your experience over the last 4 years.
Yeah, I mean, I can share first, Iryna, if you have certain ones, because I know you're frontline with our Ukrainian channel as well. I know that we've been hearing a lot from families around during the pandemic. A lot of it was isolation. So trying to raise a newborn, coming from the structure and routine of, let's say, a place like the NICU. And then being on your own and having a hard time seeing your practitioner, making an appointment, or having virtual appointments where they're just not as accessible. And when we think about parenting overall, all of our communities have come from very rich parenting communities generationally, and there's so many rich traditions. And information networks there, where a lot of how we parent, we learn from our parents, from aunts, uncles, cousins, even parents on the playground or at school time pickup or things like that as well. And and that's a testament, for example, to the community that you all have at the Premature Babies Foundation too, right? So there's so much that's there that really quickly got fragmented with the pandemic. And I don't know if we've really been able to rebuild back in the same sort of way. And so families were reaching out and saying, we have questions, we're not able to connect with the people that I otherwise would have been able to, either because of the pandemic, because of shutdowns, but also people moving, newcomers settling into places where they're on their own. I remember there was a young mom that had written to us saying, this is so helpful for me because, I'm home alone with the baby while dad is, she was saying her dad, her partner was a truck driver, so was often away for many weeks at a time for work. And she was in a country where she didn't speak the language. And so having that trust, having something, in your language, but also with a provider who looks like you, speaks your language, understands the nuances of how parenting and decision-making might be different. One other thing I think that we've learned from all of this has been reminding ourselves, that decision-making in families around how healthcare is done, how parenting is done, isn't a traditional sort of mom or dad sort of approach, right? In many of our communities, we've got really a rich role where aunts, uncles, cousins, like I was saying, grandparents play a very fundamental role. And a lot of our online followers or community members have reached out to say, hey, you know what? I may be, like for myself, I'm English-speaking Punjabi Canadian. I might like the English content for myself on the Punjabi channel, but then I can use the Punjabi version of that video for the grandparents who often have a lot to say as well. So we're on the same page. So I think there's been some really beautiful learnings around the role that this can play in terms of supporting families being on the same sort of page.
Well, and you brought something up that is so important, because we are not raising the kids alone, even though we feel that we are alone, but we always have the influence of the grandparents, the aunts and the cousins, because we try to live in a community, even though sometimes in Toronto, we feel very isolated because we don't have many of us immigrants don't have extended families. But when I had my first son here, was a term baby and healthy baby, and my mom came from Brazil and gave me all the advice from the 70s, because that's when she had me and my brother, is not what we do right now, right? The practices change, the care of the babies change, there's more evidence in certain things. So what do you address in those videos that is evidence-based today? It's evidence-based, not, from 30 years ago, that we can also educate the extended families, the grandparents. This is not only how we do things now with the babies, but it's culturally adapted to your context. So how do you address those items? Because I think a lot of families who are immigrants, we try to, this is how my mom did, but even back in my country, it's not how they do anymore, right? But how do you address those pieces?
Yeah, I mean, I can go first around that. I think, I was listening to a very interesting talk recently around, intergenerational transmission of knowledge. So, we often hear a lot about this term, also intergenerational trauma as well. We know many of our communities have gone through really tough times, and that impacts the mental health across generations, the parenting behaviors across generations as well. So in whatever way, each of us were parented, the good or the bad, part of it is, thinking about how can we distill down the gold there? What was the good stuff that was there that we can carry on? How can we shed some of the stuff that maybe wasn't as helpful? And I think that's where, Iryna's been working really hard with creating content that brings together, the science of what we have in terms of evidence and knowledge, and then taking it to our community advisory boards within each of the communities to think about what's the cultural knowledge, what is the the soul piece to it that we can put together so it's relevant for families. And I think that's the magic, and that's what people are really resonating with, where it's not colonial, it's not clinical. The idea is, how can we take the good stuff that you're bringing from your cultural background? how do we update it in a way or add on and give them the evidence of how they can bring it together and complement it along with the science piece as well.
Yeah, I also wanted to just quickly add on that we always always use inclusive language. So we usually use word caregivers, not only mom and dad, not only family, but caregivers, because every family is different and can consist with different pieces, let's say that. So yes, we always try to be inclusive and make sure that every family member was addressed.
That is wonderful. Ripu, we do have some international people watching us from different countries. Can you tell us what the BIPOC stands for?
Yes, thank you. Yes, so BIPOC is a term that we use a lot nowadays to describe so Black, Indigenous, and people of color communities. And so, you know, that's the term that's commonly used when we were choosing, you know, which communities we were going to launch our Kids Health with. We went with, we're based in Canada, so we had gone with Canadian census data about who are the largest cultural linguistic communities, both of who's here, you know, along with consideration of who's coming as well, to make sure that we had that there. Having said that, you know, we are always looking for partnerships to be able to expand, to be able to reach even more families. So currently, you know, with the channels that we currently have, with these 10 channels, we are serving, I think it's about 96% of Canadian BIPOC communities. There are other ones that we are interested in expanding out to as well, and we're looking for partnership to support both in terms of funding and then also in terms of the professional knowledge and folks that would want to be a part of the channel. I know that we have a few folks in the chat who have commented that they're from Brazil. We've been very excited to be looking for, you know, what a Portuguese channel could look like as well, in addition to more Indigenous channels and other languages as well.
And can you talk a little bit about the Black health community? Because we discussed that before, it's all in English, but you're trying to serve communities from the Caribbean, from Africa. So tell us a little bit more about the Black health community.
Yeah, so Black Kids Health, you know, has been, is our only English-only channel currently. And so when we're looking at Black communities, we understand there's so much diversity. We also understand we're not fully yet serving them in a way that we would like to be able to. I think we've got a proof of concept. The community online has grown in terms of English-speaking Black identifying families that are following right now. I don't have the exact number of the followership across those channels, but it's been growing quite quickly. And with it, we love to be able to expand out to Black Francophone and Black Hispanic families as well with further channels. So that's the vision we have. With it, it's been so interesting, and I think, I don't know if this came across in the formal presentation we were sharing, but part of it is also we're not cutting and pasting content directly across channels. That adaptation piece is important, and sometimes the topics altogether are different. So, you know, for BKH or Black Kids Health, you know, we're working on right now a series on, you know, as a Black parent, how do I advocate in the school system if my child has learning difficulties? How do I advocate in the hospital, including as a NICU parent, you know, if I feel like my concerns are not being addressed appropriately or my pain is not being addressed appropriately? We have data that shows that Black families and other BIPOC families as well have underdiagnosed pain or other sorts of concerns. And so thinking about how do we support them, because there's a unique piece there around self-advocacy and that experience as well. Likewise, for our other channels, maybe, Iryna, I'll hand it over to you, but like for the UKH channel for Ukrainian Kids Health, the sorts of questions that we've been getting have been different as well.
Absolutely. And I just wanted to say that we also trying to react on the latest news. For example, we created a content when there was an explosion on a dam. So we were creating content on how about the clean water and the safety and how do you manage that? How would you provide drinking water to a baby? So I just want to say that we always trying to adjust it to the appropriate channel and trying to make sure that our community's needs are met.
Absolutely. Let's talk a little bit about the Preemie Hub, because we talk about the Preemie Hub because so many families obviously will have preterm babies in those communities, and how they've been underserved because there's lack of information in their own language and materials that are culturally adapted to them. So we came together, and based on our experience work with these families, we came up with some ideal topics I would like to start with to serve the majority of the families coming to the NICU. And we plan to expand the topics because there's so many topics related to preterm birth. So how are we adapting those materials for different communities, considering that there are some very basic information about the NICU? What is the NICU? How can you be involved with your baby in your baby's care in the NICU? What is your role as a parent in the NICU? Because we don't know our role coming to this new world of in the hospital and intensive care unit. So how are you addressing those in different communities? There's something that is like the foundation of becoming a parent of a preterm baby, and then we can talk about the outcomes after.
Yeah, so I think, when we're thinking about the content for the Preemie Hub, kind of in this iteration, and we're crossing our fingers to be able to create more content for the future as well. We know that, preemie families, there are some really important experiences that we want to be able to support families through. And so some of that is during the NICU, and some of it is in the follow-up in the years to come, right? When you're at home with your child in later youth. And so some of those experiences, we've heard from preemie families as well, when you're suddenly kind of thrown into this hustle and bustle of this unit. You're told you're a part of the team, but what does that actually mean? And how do you participate in that? What is this routine in terms of rounds and like all of the different sounds and whistles and alarms that are going off? And so you feel like an outsider in this space where your baby is. And in addition to that, there's also the other dimension of feeling like an outsider if you're a newcomer, if you're a person of color, as well, in an institution that is otherwise very, exclusive for you. So that's where we think we can really help make a difference, is having some of those resources. In terms of the adaptation piece, we've got some content that is evergreen, which I think is similar across different communities. But then really the adaptation happens when, we take some of our general content, and then each of those wonderful, the photos that you saw earlier of our different community coordinators takes that information back to a very rich community advisory board. Many of them have, I think across our different channels, we have about 75 different partner agencies. And so they will go back to their community advisory board, which is community champions, leaders, and agencies that are focused on the well-being of that cultural linguistic community, and then sit with it and think about what are the adaptations we need to create here? What are experiences, either in terms of data or what we're hearing from lived experience, that we can include here? What are common questions? What are common myths that might be different between communities where we need to adapt it and include that as a part of it as well? So I think, for example, sometimes that is, what is the caregiving structure, or what are common decision-making practices? What are things that might be barriers in some communities where we think about how historically a family may have interacted with the healthcare system, et cetera? So are there things there that we can factor into that content? So it's not, like I was saying, a cut and paste, but something that's adapted to how members of that community are used to participating in the healthcare system and making them feel empowered.
Absolutely. And it's so important. And I am so looking forward to seeing all these materials that have been created and continue to provide more information and education for families, because there are some topics that are much harder for many communities, such as addressing the parents' mental health. There's so much stigma around mental health in so many communities. Also, having a child disability. We know some of our preemies will eventually have a disability because of their journeys, how sick they were. And it's important that how we're going to address the stigma about having a child with disability with all these materials that we are creating. And I'm so looking forward to continue this partnership. This is just, today is really just the beginning of, I'm hoping, many years to come. And I'm so grateful that Zanuf Canada saw our vision and support this program for CPBF to partner with you. And I'm really looking forward to many more videos and much more content out there for families across Canada. This is really part of who we are, an organization to serve Canadians, no matter where they are in Canada. And with your platform, it's amazing to see that it's way beyond Canada, and we can support communities around the world. I'm very, very grateful to both of you for being here today. And Iryna, thank you so much for this incredible journey for the last, 6 months of creating content, 1 year that we start our conversations. And I'm really, really grateful to both of you for trusting and partnering with CPBF in this project. And I can't wait to what is coming next for us.
Thank you.
Thank you so much. We're so excited about this collaboration and for great things to come in the future. So I invite everybody to stay tuned.
Yeah, so next week, we're going to have the first videos available. Iryna, can you talk a little bit about that, where people are going to find? We do have a page on our website that as soon as you have on yours, it's going to be linked across platforms, social media. So tell us a little bit more about that.
Absolutely. So starting Monday, we will see our first posts on our social media channel. So you can access either through the particular channel. So for example, it's Hispanic Kids Health, Our Kids Health, or Ukrainian Kids Health, etc. Or you can use this hashtag OKH Preemie Hub, where you will see all posts together across the channels. And yeah, stay tuned.
Wonderful. Thank you so much for being here with us today. And I see you next time.
Thank you.
Thanks so much.
And to all of you watching us live today, thank you so much for joining this episode of Preemie Chats. And a special thanks to our sponsor, AstraZeneca, who makes educational sessions like this one possible. And just a reminder, if you missed part of today's session, head over to our website, which is the canadianpreemies.org, to see this episode and all past sessions of the Preemie Chats. We have over 340 videos there. And we also find many resources and support options available there. And be reminded that CPBF is a charitable organization and depends on support to continue its important work. So consider how you can support CPBF and its mission to empower families of premature babies in every step of their journey. Together, we can create a brighter future for all preemies and their families. And you'll see again next Friday, 1 p.m. Eastern Time. Stay well.